Welcome to Dizzy Therapy. I'm Anthony Veglia, but a lot of patients call me Doc. I'm a doctor of physical therapy who specializes in vestibular rehabilitation, which means that I treat patients with dizziness, imbalance, and vertigo 40 hours every week. Let's talk. Let's talk about Meniere's disease, or you may have heard a related term, endolymphatic hydrops. There is a lot to cover here, as this diagnosis could be a bit complicated to explain, but pause, rewind, take notes if you need to. Right off the bat, there are 4 main symptoms to Meniere's disease that we need to discuss. Number 1 is hearing loss, and it actually can fluctuate quite a bit with Meniere's. Some days are going to be easier to hear than others. Number 2, tinnitus. Sometimes you'll hear tinnitus. It's a ringing or a whooshing sound inside the ear, and with this diagnosis, it can be extremely loud at times. A lot of people say it's more like roaring than ringing. Number 3, oral fullness, which is a sense of pressure in the ear, like when you try to pop your nose or when you change elevations, like driving up a mountain. Pressure in there. And number 4, vertigo, a big spinning sensation, specifically with Meniere's disease, can last for hours and hours at a time. So the 4 cardinal symptoms of Meniere's disease are fluctuating hearing loss, tinnitus, fullness in the ear, and vertigo lasting for hours. Now, at some point, most patients are going to experience all 4 of these. But depending on the person, you might have a different order in which all 4 of them appear, and they might be different severities for you. So maybe one person has more of the tinnitus than they do the vertigo. Some person may discover they lose their hearing very early, but the other ones don't show up for months. So this diagnosis can be very personable and variable to you. But how do we get here? What is causing all 4 of these symptoms when they seem so different? Well, first things first, we need to discuss the source of our hearing and most of our balance, the inner ear. This is Earl the Ear. He's a right ear, by the way, and we're going to show you what's going on. Now, when I'm looking straight ahead, my right ear is angled about here. My big floppy outer ear is out here. The long ear canal, an eardrum which vibrates with sound to hit some bones, which vibrates the cochlea. And this snail shell is where we actually hear things. And all that hearing information gets carried down this big nerve off to the brain. But you might notice, that's only half an ear. What about this other half? So this other half of Earl, this crazy maze here, is totally separate from your sense of hearing. This is my area, the vestibular system. This is where our balance awareness and orientation takes place 24 hours a day. These tubes here are full of fluid very similar to ocean water, and it moves whenever you do. I always think of a hula hoop full of water. If you were to turn, well, that water would move too. At each of these 3 dead ends, there's a little flap that acts as a sensor. Whenever you move, you can tell what direction and how much you've moved, and all that information can get sent down these nerves to the brain as well. Now, deep in this area, it's not really shown, it's inside of Earl, there's a bunch of crystals that make a bed and a wall. And what they do is, if you imagine a buoy in the ocean, it's got a long rope to the bottom. If you saw it moving one way or another, you would know which way the water is moving. And these crystals, that's their job too. If you hit the brakes in the car or the plane takes off or you stand up, you can feel momentum forward, backward, even sensing gravity with the wall of crystals. So, all of that information for your balance, for your orientation, gets sent down the vestibular nerve. All of the hearing information goes down the cochlear nerve, and then it combines into the vestibulocochlear nerve. Now, unlike a labyrinthitis, where the nerve is the thing that's damaged, or vestibular migraine, where the brain is at fault, Meniere's disease really does take place inside of the maze here, specifically the fluid. There's actually two fluids all around your ear, inside. Endolymph and perilymph. Endolymph has a lot of sodium, perilymph has a lot of potassium. And on this plate, we need to keep the mashed potatoes and the peas apart. These two should never mix. Now, I'll try to keep the chemistry pretty simple, but basically, water will go to the sodium. The term osmosis applies here. Now, for reasons that we do not know yet, some ears really struggle to keep the chemistry all working properly, and the sodium level seems to get really high in the ear. Audiologists have a test called electrocochleography, which actually just measures how much sodium and how much potassium are in the ear. If sodium gets too high, too much water will flood in there, and if it hits the limit, the wall between those two fluids will break. If it breaks, everything goes haywire. Your motion sensors will tell you that you are spinning and spinning. Your sound sensors can be damaged, leading to that tinnitus, that hearing loss, and this will just keep going and going until that wall gets built back up again, which can take hours. So those big vertigo attacks can last so long. This flood that's overpressurizing the whole inner ear, that is called an endolymphatic hydrops. Again, we know what is happening in the ear. We don't know why. For some people, it might be genetic, but only about 10% of cases have a family history. I've treated patients where many members of a family have it, but for others, like my own father, no family history, no prior inner ear issues, suddenly symptoms just started. It's a little more common in women. It usually happens to a person around 40 to 60 years of age, but other than that, there are a lot of open-ended questions. Again, we know what's happening, we're just not sure as to why. As far as treatment for Meniere's disease goes, the big theme here is managing exactly how much water is in that ear. Diuretics from your ear, nose, and throat doctor, your ENT, it's a medication that can help rid you of more water and sodium. Diet changes that can help reduce how much salt's coming in, as well as reducing caffeine, alcohol, and other things that can lead to attacks. It's really important. There are also injections they can put directly into the ear that can help keep things level as well, especially early on. But where does physical therapy come into this? Well, PT exercises are not going to prevent attacks, but really help with the lingering effects. When the attacks actually happen, the ear itself can become damaged. And just like my video on vestibular neuritis talks about, when one ear is weaker compared to the other, chronic balance issues and dizziness can be the result. So really, the vestibular rehabilitation is for the time in between the attacks. Simple exercises to help challenge your dizziness and balance, keep you as symptom-free as possible in between the attacks. So, your ENT doctor is here to help diagnose, prescribe, and manage the lifestyle changes to prevent attacks. An audiologist is here to test for those salts in the ear and to track any hearing loss, see how much we can prevent. The PT is here to help keep you working through the instability and keep you as little symptomatic as possible outside of the attacks. It really should be a team approach, as with any diagnosis, but especially this one. The hardest part of all this really is the early phase, but there really is hope. The lifestyle changes can be a big difference initially, and for most of my patients, the dietary changes to limit sodium is the most difficult. And there is some uncertainty on how much effect it will have as a whole, but I will say, from my patients, it can make a huge impact. Some people really notice a distinct difference when they start to increase sodium again and they go back down a lot more stable. With all of these individual treatments, attacks can become pretty rare, and the phases in between the attacks, much more normalized. So most day-to-day life can feel pretty normal again. There really is hope, despite how intense Meniere's disease really does sound. Like I mentioned, there's a lot of personal variability to this disease. The treatments I mentioned for some patients make a huge impact, while others may still continue to struggle. In rare circumstances, there are actually surgeries that can be performed to help with Meniere's disease. One of them involves placing a shunt into the ear, which drains excess fluid when pressure gets too high down into the stomach, making it less likely to have an attack. Another more extreme option is to have the entire nerve from the ear to the brain cut. This will cause complete deafness and a total lack of balance information from that ear. So there's a serious need for vestibular rehabilitation after that. Keep in mind, this is very rarely performed and very rarely ever needed. Most patients are going to see improvement with the treatments I already mentioned. But with treatment and symptoms under control, what about the long term? What's a lifetime with Meniere's look like? Well, for a small number of people, the opposite ear can actually develop Meniere's disease as well. This is very unpredictable and fortunately is very rare. I've seen dozens and dozens and dozens of patients with Meniere's disease, and one, maybe two, actually had it in both ears. So it is pretty darn uncommon. On the other side, many people with Meniere's disease, just as mysteriously as it comes, after 5 to 15 years, it can just stop. The ear just reaches a stable point, no further hearing loss, no further vertigo attacks. Don't fully understand why this happens, and we don't really know how to encourage it, but it's great news to hear when you're dealing with such a challenging diagnosis. Even if it is something you are developing, it's not a lifetime. Meniere's disease can simply end. To summarize, Meniere's disease is a disorder of chemistry within the inner ear and leads to vertigo attacks lasting several hours, ringing in the ear or tinnitus, fluctuating hearing loss, and pressure in the ear. Those are the 4 cardinal symptoms. With an ENT, audiology, and physical therapy backing you up, this is very manageable, but it really should be a team approach to diagnose, manage, treat the symptoms, and adjust your lifestyle. By changing your diet, taking medications, performing vestibular rehabilitation, these are all important because it can give you the best daily life possible while living with Meniere's disease. Meniere's disease will often end on its own after many years, and in extreme cases, there are surgeries to consider. This is a complicated diagnosis, and at the onset, it can be very intimidating, but across the many patients I have had the pleasure to work through and help through this, and seeing my father's own journey with it, I will tell you again, it is something manageable, especially as these lifestyle changes just become your daily routine. So there is hope. And that's it for Meniere's disease, as well as endolymphatic eye drops from a vestibular physical therapist. Don't worry, it sounds intense, but there is hope. Thank you so very much for watching. Always stay curious about these incredible bodies that God has designed for us so well. Leave a question in the comments below because I would love to know what you all want to learn. Subscribe to Dizzy Therapy for more videos in the future. And remember, dizziness, imbalance, and vertigo are never normal. So visit your ENT and vestibular physical therapist as soon as possible so you can get back to moving freely. Have a great rest of your day and may God bless you with stability throughout your dizzy therapy.